Delta Dental is often seen as the 800-pound gorilla of the dental insurance industry. And if you're like most dentists, you fall firmly in the category of having the dental insurance blues. As insurance reimbursements decline, and they're going to continue, more of the cost burden is being shifted to the patients. And that means that patients are simply going to defer the care because they can't afford it. Now, you don't have to have the blues. Stay tuned, because after the break, I want to show you how you can make dental insurance pretty much irrelevant to your success. I'm Colin, receiver. Thanks for watching the Patient Attraction Podcast. Now, for most dentists, dental insurance falls into the category of a necessary evil. Now, there are a lot of patients who wouldn't have work done without it. But there's also a lot of prospects who aren't going to have work done because their share of the bill is just too much. Now, you can pretty much thank Delta Dental for shifting more of that cost to the patient. Delta got the ball rolling when it came to cutting reimbursements to dental practices. And of course, other insurers followed suit. The upshot of decreased reimbursements is twofold. As I mentioned, prospects defer care, and the ones who seek care are looking for the lowest price. Now, if that's you, you're going to get even less than you would get normally. So given the current state of dental insurance, it's certainly understandable if you have the dental insurance blues. Now, let's change that. We'll start with who you're marketing to. Now, for most dentists, they're marketing to the price shoppers, the one and dones, the insurance-driven prospects. If you don't target those low-value patients, you're probably thinking, I'm nuts. Now, maybe so, but let me ask you this. How do you market your practice? Are you emphasizing low price and low quality? Well, of course not. Note that I said emphasize. It's generally a mix of the two. Which one dominates your advertising? Odds are you're pushing price point specials, discounts, and insurance acceptance. So what you get are price shoppers, one and dones, and not enough insurance reimbursement. Now, don't feel bad. Most dentists do that because that's what they see other dentists do. But there's a segment of almost every market out there, about 40% of the prospects, that aren't insurance or price driven. Let's call them the better patients, right? These better patients have the means and the willingness to pay more for a dentist that they know, they like, and they trust. One they can just relate to, right? And they're generally extremely loyal once they decide on the right dentist for them. Their lifetime value to your practice is many, many times that of a one and done. And you don't have to devote part of your marketing budget to replacing them every month, month over month, because you're losing those patients out the back door. Those are the patients you want and need to grow your practice, regardless of what dental insurance does. But you're not going to get better patients if you keep chasing after the low value ones. Instead of the monthly and quarterly advertising, you got to have a system that works for you 24/7. And what your system needs to do is to convince these prospects that you're the right choice for them. Dr. James Keel looked at various dental marketing options, and then he became a SmartBox dentist. Why? Because our industry-leading patient attraction system helps him as well as 550 other dentists around the world. He said, quote, "Since we've implemented our patient attraction system, we're definitely getting the quality patients that I want to see come into my practice." Now, if you're serious about growing your practice and you're tired of singing the dental insurance blues, check this out. Visit smartboxwebmarketing.com/practice discovery session. We reserve these calls, these practice discovery calls that we have with you one-on-one, for dentists who want to see what our patient attraction systems can do for their practice. It is possible to attract more and better patients and kiss those dental insurance blues goodbye. Join me for our next podcast. Until then, keep moving forward.